basketball player, football player, policeman. I never want a doctor.
So how do we get our kids to do that? You know, I mean, like you said it, so what promoted you to do it? How do we get that message out to the kids?
Let's celebrate y'all. Dub C, Chris Phoenix, Philly Cherie.
It's your birthday. It's your birthday. It's your special day. It's your special day. It's your birthday. It's your birthday. It's your birthday. Time to celebrate. Time to celebrate.
Guess what day it is? It's the day for.
What I mean by mentors, I mean when I'm going to medical school, seeing a physician that looks like me that has gone through some of the racism or bigotry that I had to go through growing up, looking at that person and saying, "This is I can emulate you. I can do some of the things you did," would have been very nice. And I feel like as though that not a lot of kids in our community have that opportunity.
And it's really ultimately about people being able to have a fair share at opportunity, unbiased opportunity, to be able to succeed. Not just, as I always like to say, to survive, but actually to thrive. And that's actually part of what is in fact not happening for so many of our people. Or when it is happening, we gotta work double, triple time to be able to get that. If we can't come to a place where we, one, have an effective healthcare system, as these fantastic speakers talked about, right? Where we're really recognizing both the limitations that exist in our system, such as it stands, and we're able to address, for real, like not tap dance and, you know, let's do this half-step kind of mess, really address these issues so that we can maximize good health for everybody. And along with that, look at the factors that are related to health and say, why should we shortchange these opportunities for people from the get-go? And then, to boot, have the nerve to expect that they're going to be able to keep, you know, being thoroughbred horses and keep jumping over hurdle after hurdle after hurdle, and in the end be able to succeed. Why? Somebody help me out with that.
It's your birthday. It's your birthday. It's your special day. It's your special day. It's your birthday.
Just as the community is interested in who will be their health care provider, your hospital and your institution is also interested in who will be delivering care as we move into the future. And with that, I introduce Mr. Joe Wilkins. Mr. Wilkins is Senior Vice President at Atlantic Health, and he has the coolest sounding job in the world. He's the Chief Transformation Officer.
Good afternoon, everyone. I'm going to stand up and also represent the American Hospital Association. We have a serious pledge with most hospitals in the United States that are pledging for health equity, that are measuring the results, that they're designing their training around competent communication with consumers, and we're actually measuring the level of progress around executives and C-suites in our hospital organizations as well as boards. And so I'd love to update you more on that information, but we are really driving forward. The good news is just about every major healthcare facility in New Jersey has pledged to that equity of care campaign, so I think that's a good. My commitment from my boss, Brian, to this community, to the NAACP, let's figure out how we can collaborate better from a health system perspective to make a difference to healthy communities for all people.
You're God's greatest design. You work hard every day and you deserve a good time. So let the drama go. Pause the stresses in your life. Stop the calls, it's time to go. It's your turn to play tonight.
It's your birthday. It's your birthday. It's your special day. It's your special day.
If we don't get those kids by the time they're they're 8 years old, by the time they get into middle school, before they get into high school, we have to let them know that you have
to be a doctor. No, not that you have to be a doctor because we need you. You can see all your records. The doctor releases your lab tests, communicates with you by email. It's this new kind of model of care that means that you don't always have to be in the doctor's office. You're not always calling. You're not always relying on me to send you a copy of your lab work. It is there on the portal for you to see all the time because it's actually your record.
So although the repeal and replace, we were successful, all of us, in making sure that did not happen, we have to continue to stay engaged because there are a number of smaller bills that will still chip away at a lot of these policies and things that help us in order to have access to health care and to get coverage. We talk about advocacy. How do you do that? What are the issues in health care? This is what impacts my community. How do I go to my member of Congress or to my state legislator and talk about this issue?
Two-step to the beat, 'cause we rockin' it right. Chris Phoenix on the boards, Dub C on the mic. There's a dance to the song, there's a step to the groove.
And I so appreciate it. She did an outstanding job.
Let me show you what to do. You started out with a 2